Multiple sclerosis, or MS, is a disease that affects millions of people in the world and is more likely to affect women than men. But what causes it? What are the symptoms and what can be done to treat it? The doctor is in and he has some answers for us today. Dr. Scot Ackerman, one of the First Coast's leading oncologists. He joins us every Friday to talk about important health issues such as this. Dr. Ackerman, thank you so much for being here as always.
Thank you, Casey.
So let's talk about what MS is. What is it? It's a disease, but kind of expound upon that.
So MS, multiple sclerosis, is an autoimmune disorder. This is where the body is attacking itself, and specifically the body's immune system is attacking the myelin. The myelin is a sheath that surrounds the nerve fibers, and the body's immune system attacks this myelin, the sheath around the nerve fibers of the central nervous system, the brain, the spinal cord, and the optic nerves. And you may say, okay, so what? Well, myelin has a function. It insulates the nerves, and it helps so that the nerves can send electrical signals down in a very efficient way down through the body. When this myelin is damaged, the nerves aren't transmitting electrical signals very efficiently. The myelin's damaged, scar tissue forms, it causes pressure on some of the nerves, and so some of the signals, the electrical signals that are going through the nerves in the brain or in the spinal cord or in the optic nerves, they get transmitted improperly, and you have symptoms of it, and you don't function, and you are neurologically compromised.
So then, do we know what causes MS?
Sadly, we don't. We're very unsure of the cause. We do know there are a few things we can associate with MS, and we're doing a lot of research now to try to find the cause of it. If we knew the cause, we would be able to treat it better, and hence the problem. But we do know that it affects women more often than men. The highest, the ages where we see it most often is in people between the ages of 20 and 50. That's when it's diagnosed. They live with it for many, many years, but usually it's diagnosed somewhere between the ages of 20 and 50 in women more often than men. We see it in northern latitudes more often than southern latitudes. So because of that, we've had some postulation about the causes. One is maybe it's genetic. Women more than men, maybe there's a genetic factor. Number two, maybe there's an environmental factor as well. We haven't been able to identify yet. The third, maybe it's vitamin D deficiency, because if people move in the northern latitudes where there isn't as much sunlight to the southern latitudes where there is, they seem to get a little bit better. Also, we see it less often here in the south, so maybe there's a vitamin D deficiency that's associated with it as well.
So how does one know if they are affected by MS? What are some of the symptoms that you should be on the lookout for you or a loved one?
Well, a definitive diagnosis is difficult to make. It's really a diagnosis of exclusion. The symptoms one has with MS are common symptoms that you could have with all sorts of things. Pain in the extremities, pain in the arms, weakness in the arms or the legs. A loss of balance when the multiple sclerosis affects the cerebellum or the back part of the brain. It can affect your ability to have balance, or even in the spinal cord, there's nerves there that affect our balance as well. You can have muscle spasms, you can have vision problems. It affects people's ability to speak properly, to have trouble with cognition, fatigue. Any one of these symptoms, either small or large, are all part of MS. So some people have very, very minor symptoms and they're diagnosed with MS, when some people have all of these symptoms. If multiple sclerosis is suspected because of these symptoms, the neurologist can do some additional tests, but none of them are really a definitive diagnosis. But frequently the neurologist may get an MRI of the brain or the spine, and we look for certain plaques that form on these nerves, and maybe also a sampling of the spinal fluid to look for certain proteins in the spinal fluid.
So what does the future hold then for treatment and diagnosis? I mean, is there a treatment? I mean, is there hope for a cure for this?
I think there's a lot of future. There's a lot of research funding for MS. You heard about the MS 150, a lot of fundraisers for MS. So there's a lot of money being used for research. Sadly, there hasn't been a cure for it. There's been certain treatments for it that have slowed the progression of symptoms. When someone's diagnosed, they usually live with it for many, many years, and the symptoms are slowly progressive all of those years. And so we're trying to find ways to slow down those symptoms. One thing we found recently to help us with early detection, we've identified a certain protein. It's called KIR 4.1. You don't need to know the name necessarily, but we have identified a certain protein which is linked to an antibody associated with patients with MS. We've also had some advances in treatment. There have been some different drugs we tried over the over the years. Some have helped, some haven't, some we thought helped, but actually they hurt some people. But recently, a pretty simple drug that we've talked about here before, a drug called Zocor. Zocor is a drug we use for cholesterol, and we use it to prevent heart attacks in people that are at risk for having heart disease. Well, the same drug, Zocor, has been shown to slow down the progression of MS. So I think there's lots of research. I think we're going to see lots of developments. I certainly hope and pray that we do, because this is really a devastating disease for many people.
All right. Dr. Ackerman, sir, thank you so much for being here. We appreciate you as always, and thanks for sponsoring the segment and coming on every Friday to give us valuable information. If you have any questions regarding today's health topic or any other health questions that you might have, you can visit Dr. Ackerman's Facebook page, which is simply facebook.com/First Coast Oncology.